Good morning. This is Patricio Bedia, and we're here in Washington, D.C. for the third day of the Alzheimer Forum. We're here to speak to the advocates about their legislative visits.
My name is Suzanne Brisson, and I'm from San Francisco, California.
Yes, I'm Karen Stevenson from Berkeley, California.
My name is Noni Green, and I live in Tiburon, California.
My name is Zach Smith. I'm from Moraga, and I'm with the Northern California and Northern Nevada chapter.
Hi, I'm Paul Barrett.
Linda Rodesno from Citrus Heights, California.
I'm an advocate because I have had two parents with dementia. I lost my dad and still caring for my mom. And I wouldn't wish this on my worst enemy.
Yes, I'm an advocate because I lost my mom to Alzheimer's disease after a 15-year struggle, and I wanted to see what I could do to help other people with this difficult disease.
I'm an advocate because right now it feels right to jump into this. I've been an advocate for other things, but Alzheimer's, the increase in Alzheimer's, my mother has Alzheimer's. It's the right time to do this. So, and it's a challenge to get people to be aware. I wasn't as aware as I should have been, and I'm hoping to alleviate that for other people.
I'm advocating today because I found the association through a personal story with my grandma getting Alzheimer's disease, which was a terrible detriment to my family, and I started looking at it from more of a macro level and realizing the crucial need for funding for this disease, given the trajectory that is set to pan out for the disease.
I'm an advocate because my wife has younger onset Alzheimer's disease, and when I went to my first forum, I learned so much about the impact this disease is going to have on the country. I just knew I had to get involved and help people learn more about the disease like I had learned.
I'm an advocate because my mother has Alzheimer's disease and my father has Parkinson's disease. I've learned to recognize that I need to lend them my voice, and to millions of Americans in similar situations like them who can no longer speak for themselves.
So far today we've met with two congressmen's representatives, a representative from Doug DeMolf's office, and she was very sympathetic because four of her grandparents had dementia. And we've also met with a representative from Garamendi's office, and he's been a co-sponsor of the work that we're asking other people to co-sponsor today. So we had a great meeting and thank her very much for their cooperation.
We met with Senator Dianne Feinstein today, and she was very, very receptive to what we had to say. She agreed to become a co-sponsor of the Hope for Alzheimer's Act, and she agreed to consider seriously our request for $100 million in additional funding for research and care support.
I met with my rep, Jared Huffman. He's brand new, and boy, he's right on board with helping folks with Alzheimer's and also passing good policy to basically, we want to eradicate this disease. We want to diagnose it, we want to treat it, and we want to get rid of it. And right now there's no treatment really and no cure. And it's the most costly disease in the United States right now. Jared, the area he represents, as he says, we are a little bit of a graying area, and the bubble of the boomers is really going to escalate the costs associated with people with dementia and Alzheimer's.
The meeting with Congressman Miller's staff went incredibly well. He had a wonderful staffer who was very receptive.
All three of them actually went extremely well. People very receptive and supportive. They understand the issue, and it was great. Everybody, there was no resistance whatsoever.
My last legislative visit was with Congressman Omni Berra, and it went fantastically well. I found it encouraging and inspiring. I definitely feel that he is an advocate for the Alzheimer's Association and for all of the work that it is currently doing.